Hello once again. My name is Mike, and in part 5 of this video, I'm going to give you an update on my final post-op visit with Dr. Kriteman, which took place on Tuesday, September 6th at 8:50 a.m. And this was about 4 months out from my procedure. So before I went to see Dr. Kriteman this time, I wrote out 4 questions that I wanted to ask him. I also wrote him a short letter where I provided my link to the videos, hoping that he would maybe view them and then we could discuss them at a future date. However, when he entered the examination room, the first thing he said was that I had gotten numerous phone calls from various people, all asking me about your videos. So I showed them to my wife, and my wife is an attorney, and she thought that they were quite slanderous. So she reviewed them and then sent them to the attorneys with Georgia Urology, and they reviewed them as well. And they were about to bring a case against me, he said, for slander. But he told me that he said not to proceed, not to move forward, and to just let it go. So I thanked Dr. Kriteman for that, and I asked him, did he want me to remove the videos? And he said that he did, and that he didn't want to see that I made any more videos. So I changed the subject a little bit, and I said, partly the reason why I made these videos, let me give you an example. Remember when I told you about how my catheter had become blocked and there was nothing I could do, and I was reaching a crisis mode with the urine backing up into my kidneys, and I was just left to handle it on my own? Well, Dr. Kriteman said, there were several numbers that you could have called. And I reminded Dr. Kriteman, I said, in my videos, I explained that I went through all the paperwork and there were no numbers for me to call. Also, I looked up some numbers on my own and tried to get through to Georgia Urology. Being that it was a Saturday morning, I had to listen to a long-winded message, and then finally I would be connected to a on-call physician where I could either speak to someone or leave a message. And every time that I did that, either the line would go dead or the message would stop. My wife and I together, we probably made 10 different calls using several different numbers, and every time the same thing. Either the line would go dead or the message would start where I could leave a message, and then within 2 or 3 seconds, it would just hang up. So Dr. Kriteman said to me, I've never watched your videos. I've never seen them. And that really caused me some pause. And I thought to myself, Dr. Kriteman, he just doesn't get it. So I changed the subject a little bit more, and I said, in these videos, I was very complimentary of your PA, Clint Manley, who took wonderful care of me along with his nurse. Now, a typical answer would be, or response would be, yeah, I agree. Clint is a very fine PA. But instead, all Dr. Kriteman said was that Clint Manley was not responsible for my primary care. And I thought that was kind of an odd response. So now I realize that I probably wasn't going to get anywhere with Dr. Kriteman talking about my videos. So I changed the subject to the reason that I was there in the first place, and that was my post-op appointment. Like I said, this is about almost 4 months from the procedure itself. So I asked Dr. Kriteman, would it be okay if I asked him 4 questions? And he told me, okay, that it was fine. So I asked him 4 questions. The first question I asked him was this. Suppose in 3 to 5 years, hypothetically, I'm living in Florida and I go to see a urologist and he does a cystostomy where he looks inside my bladder. Will he notice right away that I've had some type of procedure? And Dr. Kriteman said, yes, that he would. And I said, why? Because what would he see? Scar tissue? Dr. Kriteman said, no, he will be able to see that I did a resection and there'll be a big hole around your prostate where it was removed. Okay, I thanked him for that. So I asked him my second question. I said, when I go to see my general practitioner doctor, and as part of the physical, they do the PSA, how should my numbers be adjusted? He said, well, since I've removed about half your prostate, your numbers, PSA numbers, will probably be cut in half. He said, But don't try to change the numbers any. It's fine. Just go by the numbers that they give you from now on. But just know that from the last time to this time, it might be cut in half. So if your prostate or your PSA number was a 4 last time you had your physical, it's probably a 2 now. So just continue to monitor those numbers, and if it gets high, just like it normally would, if that's the case, then that's the time to be concerned and maybe see somebody about that. But don't worry about the adjusted numbers as far as the PSA is concerned. So then I asked him my third question. I asked him why I was retrograde. And since this is a public video and I don't want to embarrass anybody that may be watching, if you don't already know what retrograde means, then you should probably go and look it up, and then you'll understand. So I asked again, why I'm retrograde, and Dr. Kriteman's response was, well, if I tell you why you're retrograde, you would probably be upset with me, but just know there's a possibility that this could improve over time, or it could be this way for the rest of your life. I said, okay, I understand. And then I asked him my final question. I said, Dr. Kriteman, how long do you think it might be? I know this is just an estimate, but how long do you think it might be before I start having symptoms of BPH again? He said, hopefully you won't have symptoms for another 20 to 25 years. So I thanked him for that. And then he hurried me out of the office. He wished me a good luck, and away I went. And, he really couldn't wait to get me out of the office. And I guess I can't blame him for that. So let me just tell you a couple of things and look right into the camera and tell you this. I don't think that any of my videos are slanderous at all. I think it's just an honest and forthright account of my experiences and my feelings after having gone through the Aquablation process through Georgia Urology and Dr. Kriteman. Now, Georgia Urology, if they go back and they do a little bit of discovery, they'll absolutely know without any doubt that they've had many, 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 many problems with their telephone system going back for quite some time. In fact, long before I had the Aquablation process, when I was trying to contact the scheduling nurse, it took a whole lot of phone calls over more than a week before I finally got through, or she finally got the message and was able to call me back and schedule me in for the procedure. So I know without a doubt that they have problems with their phone system, which is also frightening because people like me who are post-op and need to call in over the weekend because they're having a crisis, they really should, as the medical profession, be able to pick up the line and talk to somebody. As far as Dr. Kriteman goes, I don't think I've slandered him either. I've never maligned him. I've never called into question his capabilities or his experience as a physician. It's pretty much always been mostly his bedside manner and his attitude that have given me a little bit of pause. So I've never maligned him at all. Also, I want to say this, that I don't have an axe to grind. I don't have it in for Dr. Kriteman at all. I have no motivation for doing these videos, not for monetary gain for sure. I don't even have that many views. I just thought that I would give an accurate assessment of what it was like for me having BPH and then going through the Aquablation process in as honest a way and as forthright a way as I could. And that's what I try to do. And the reason being is that before I had this procedure myself, I scoured the internet. I scoured YouTube. I looked and I looked and I looked for testimonials by people who have had the Aquablation process, just so that I could get an understanding of what it was like for them and what it's like from the patient point of view. Now, there's plenty of doctor reviews and there's plenty of promotional reviews by the company that produces Aquablation, but very, very few, if any, testimonial for patients. So I wanted my video to stand as a testimonial, and hopefully that it might be able to help others who are going through the process. Now, finally, I want to do this. I want to make a pledge. If Dr. Kriteman can write me a short note just telling me that he did in fact view my videos and he did reflect upon them and took some of it to heart, because we can all do better. Even a physician can improve. his attitude and his bedside manner and the way that he interacts with his patients, and whether or not he gives every patient, no matter their station in life and no matter how busy he is, his same expertise and his same amount of time and the same amount of care. And then I also would like to include in that note a short letter or a short response from Georgia Urology stating that yes, we do have lots of problems in the past with our phone system, and I'm very sorry that you had to go through that crisis on your own without any support for anybody to reach out to. So if Dr. Kriteman can give me that short note, and if Georgia Urology can also give me that short note, then I make a pledge, and this is a solemn pledge, that I will take down my videos, and then I will repost some videos just detailing my BPH journey and my journey through Aquablation. But the other videos I will take down. So one of three things is likely to happen. If I do get a response from Dr. Kriteman where he tells me that he did, in fact, listen to my videos and took it to heart and reflected upon it, whether he agrees with what I say or not, at least that he's thought about it, then my videos will certainly disappear and they'll be replaced by other videos just explaining the Aquablation process. The second thing that could happen is nothing. I don't receive any response. There's no lawsuit filed against me. In that case, then these videos will stand as they are. The third option, which I hope doesn't happen, is that they could actually file a lawsuit against me for slander. If they do that, then I understand this. I am a retired educator with almost 30 years experience in the high school. I do not have deep pockets. I know that Georgia Urology and Dr. Kriteman have very deep pockets. And so if they have a mind to, they could probably bury me in litigation and probably hurt me quite badly financially. But I am adamant about the fact that I did not slander Dr. Kriteman. I told, again, like I said, an honest and forthright assessment of my feelings, my views, and what the experience was like for me. So I hope against hope that Dr. Kriteman and Georgia Urology will take the first option and then just give me a note reflecting upon what I've said and understanding my experience, because it'll make them better patient advocates in the future. If not, then we'll go from there and we'll see. So once again, I want to tell you that I appreciate the time that you took to watch my 5 videos. And hopefully, if you're thinking about having the Aquablation process yourself or procedure yourself, then this information that you found in my videos will be useful. So in the future, as you journey through BPH, which is not easy, I wish you the best of luck. Take care, and thanks again for listening.